Hanita lenses, trusted by ophthalmologists in over 40 countries, presents real-world data of the Intensity Pentafocal IOL, the first and only lens of its kind. The Intensity IOL is uniquely designed with 5 optical foci, offering continuous and uninterrupted vision. With 93.5% light efficiency, the lens minimizes visual disturbances while enhancing contrast and clarity. This energy-efficient design supports sharper and more reliable vision for patients in everyday life. Clinical data confirms consistent visual acuity across the defocus range, maintaining smooth performance from far to near. Patients benefit from balanced, high-quality vision that meets their daily needs. Refractive outcomes highlight the precision and reliability of the Intensity Pentafocal, consistently achieving surgical targets. The lens demonstrates contrast sensitivity comparable to the normal phakic population, maintaining clarity and minimizing disturbances under both photopic and mesopic conditions. With its dynamic light utilization technology, the Intensity IOL enhances light efficiency and visual clarity. Patients report high satisfaction, achieving dependable vision across diverse daily tasks. Hanita Lenses remains committed to advancing ophthalmology through clinically proven solutions. To learn more about the Intensity Pentafocal IOL, contact us today.
The evolution of IOLs in cataract surgery is constant, and along with it, new materials and techniques to optimize incoming light and focusing it on the retina. Chairman and Director of the David J. Apple Center for Vision Research in Heidelberg, Professor Gerd Auffarth, was on hand to reflect on his research into modern multifocals as an answer to this problem, including the state-of-the-art in high-performance pentafocal optics.
We have seen over the last 10-15 years, first of all, an awareness that dysphotopsia and distribution of incoming light is a problem or is a topic. The more you extend the depth of focus, the more it influences dysphotopsia, halo size, halo intensity. You cannot get rid of that, but you can make it smaller, you can make it less intense by the way you distribute the light. So it has been addressed by all companies. Some of the older, long-standing products are still based on that technology, but newer products like the Intensity or other lenses on the market have adapted to that and find new solutions for it. The name dynamic light utilization applies to the way light was distributed. The way the light is distributed through it depends on the heights and the distances of these little rings that we can see. With their Intensity, AI technology has been applied. The computer develops models, and you continue to do the modeling and the simulation and the modeling and simulation. You do hundreds of iterations until you ended up with the most efficient usage of light. What you can have with diffractive lenses is foci on different orders. And they can be around 0, so you can have minus and plus first and second order and so on. And what you also can do with diffraction is to use light from 2 foci and move it to other areas. We call that intensifier. And by this way, you can have a pentafocal lens, which essentially has a trifocal performance. We get a continuous vision. So it's not only the 3 foci, also in between these foci, you have enough energy to get a good visual acuity out of it. Imagine if you're sitting in your living room, you want to see the TV, and it's 2.5 meters away, not 3.5 meters. And then you are in this little zone where you have some unsharp images. We have a lot of complaints in older lenses from patients. And this had been addressed by having this continuous light distribution and this plate face in the defocus curve. With the Intensity, we have one of the best defocus curves in the current states. We're doing studies with PanOptics, with Synergy, Zeiss, Lisa, you name it, with all of them, geometric. And it is really outstanding in terms of the reliability and reproducibility. In our study, we compare it with the Panoptix, which is actually a great lens, but it's technology 15, 20 years old. And you see some gaps between the foci there. And when you do the defocus curve, this gap is filled with intensity. I use the intensity every week, every day, more or less, in clinical patients, in my private patients, and also in studies. I use it in a couple of fellow doctors from my clinic. There are some anesthesiologists and some others where I recommended this lens for them or motivated them to be part of the study because I'm very secure in my opinion about it and have good results, and they all appreciate that. Yeah? So it really has become one of the most used lenses in my clinic. So the clinical response from the patient is very rewarding. The patient in the clinical situation explained is that they just see that they can see everywhere. They tell other people, now I can see here and there, and tell me the situations where they think they had an advantage compared to previous times, and that other patients who got different lenses say, oh, I can do that. And so they are very proud that they can do it. With the patient who gets the lens today implanted, he will enjoy a life which is kind of uncompromised. I don't think he will have the desire for an upgrade or something like this later on. So I think the patient nowadays will forget about its lenses because vision is not an issue. Yeah, he will just run around and don't think about that he has some special lenses because this is normal vision for these patients.
Cataract optics are evolving new solutions to the physics problem posed by replacing the lens, and patients are the beneficiaries with Hanita's Intensity, the high range of vision pentafocal IOLs. For the latest developments and research on these new high-performance IOLs and how they can change the lives of your patients, visit Hanita Lens's website today.
I started with Hanita lenses from 2016 until now with more than 7,000 IOLs implanted.
I have been using Hanita implantable lenses already for 2.5 years, and I have been extremely satisfied with this brand. It's really amazing how they are into continuous research and development of a new enhancement.
Do you know about Intensity IOL? This is a new technology with 5 foci, symmetrical distributed, to provide your patient continuous vision.
I've used already the Intensity lens, which is a wonderful lens because it has pentafocality. It gives a good range of vision and a continuous vision without interference or loss of focus in between one distance and the other, and it's really a good result that I get from those lenses.
I've been using the Intensity lens since May 2020, and I use it in bilateral refractive lens procedures, which can be either for refractive purposes only or for cataract surgeries. And we've recently analyzed our results of using this lens. And I think that the most important part of the result is the fact that the defocus curve is extraordinary compared to other lenses that I've been using for many years now.
Most of my patients come to me because they don't want to keep wearing glasses. So, we have a broad amount of intraocular lenses out there, and you tend to go with the one that best works for you. I have found that in Hanita Intensity lenses. So I encourage you to use Hanita lenses in your practice. You won't be disappointed.
Right now, I've implanted over 1,000 IOLs. Great visual acuity. The stability is awesome. The only they have been improved with the recharge ones. So I invite you all to use Hanita lenses and confirm what I've been found in the last years.
My experience with Intensity lens has been a surprise for me for its excellent performance in close and medium continuous vision. The same was with the toric lens. The select patient hadn't problem a long time with the night vision. Me and the patient are very satisfied. Thank you.
I've been using Hanita lenses for about 3 years right now, and the visual results and satisfaction of my patients are excellent. Hanita has a wide variety of IOLs as well as a wide range of IOL powers, so we can use them in many patients. Customer service and support are excellent. I'm very happy with Hanita lenses right now.
For each intraocular lens that I I am planning to my patients, I not only see these lenses hydrophobic, hydrophilic, multifocal, toric lens. I not only see the back or axis of my patient, I also see the faces of this company. I mean, the person that's working to create this excellent lens.
Et j'ai commencé à poser quelques Intensity depuis je crois 4 mois. Les retours sont faciles et c'est vraiment agréable. Plutôt pour des gens jeunes, 60, 65 ans, 70 ans. Et puis, mais vraiment c'est facile.
Les résultats sont excellents. J'ai trouvé avec le pentafocal Intensity d'excellents résultats aussi bien avec le cylindre qu'avec le Uni, et ce sur des yeux vierges que sur des yeux opérés de chirurgie réfractive. La vision intermédiaire, la vision de près et la vision de loin sont excellentes. À l'heure actuelle,
Hanita Intensity is one of the best implants right now. It gives a continuous vision at distance up to reading, a continuous vision which has been a big problem with multifocals since the beginning. With the pentafocality of Hanita Intensity, it really provides a continuous vision.
I'm from 2020 with more than 1000 Intensity IOLs implanted, also with the toric version. My patients and I are happy with this new technology.
The experiences, the thrills, the memories all determine our quality of life. To see them clearly is priceless. Ageless as we may feel, our vision is naturally impaired as time goes by. Technology can correct it using intraocular lenses that can help us see far away and a little closer. But unfortunately, not this close. Even the most advanced lenses couldn't provide a perfect outcome with continuous vision. Until now. Introducing the Intensity IOL. Within 3 years of development and countless test loops, we created an innovative algorithm, DLU, Dynamic Light Utilization. It allows optimal utilization of light, uncompromised eyesight with minimal side effects. Intensity is a high-quality lens with top production standards. With a lens profile that has smooth, symmetrical distribution of 12 steps with different heights, allowing it to adapt for maximum compatibility to the different states of pupil dilation and constriction. Intensity provides 46% less light loss compared to its competitors, allowing continuous vision starting from a distance of 40 centimeters and to infinity, with a defocus curve allowing 6/6 and beyond visual acuity. The result? Vision redefined. So get used to a new and sharper reality. A reality in which you can continue to experience life to its fullest, keep you fast-paced, and fulfill all your dreams, no matter how far or near. Intensity by Hanita Lenses.
Hanita Lenses presents Extend, the world's first Bessel Optics Monofocal Plus IOL. Hanita has set a global milestone with the world's first Monofocal Plus IOL, enhanced by Bessel Optics technology. Bessel-like beams are commonly generated with axicons, which convert the incoming beam into a conical wave whose angular components interfere constructively on the optical axis, producing extended depth of focus. Bessel-like beams, with their unique properties of non-diffracting propagation and partial self-healing within their extended depth of focus range, are increasingly used in ophthalmology for high-resolution imaging and improved fixation targets. Hanita Lenses integrated the axicon feature onto the posterior surface of the Extend IOL while preserving a spherical geometry on its anterior surface. The extended depth of focus provides patients with excellent intermediate vision, alongside distance vision comparable to a standard monofocal IOL, all achieved within a 3mm aperture and without the complexity of multifocal designs. For apertures larger than 3.5mm, aspheric surface optimization directs maximal energy to distance vision. This means that even when patients read fine detail in dim light, they still enjoy good night vision. Clinical evidence demonstrates that patients achieved far vision equivalent to standard monofocal IOLs, along with functional intermediate vision. Using the Extend lens bilaterally with a mini monovision approach, targeting slight myopia in the non-dominant eye can potentially provide a full range of functional vision. Another key advantage of Bessel beams is their remarkable self-healing ability. When partially obstructed, unblocked wavefronts re-interfere to restore the original beam structure, ensuring stability even with minor disturbances. This suggests the IOL may be tolerant to optical path obstructions such as low-level PCO or floaters. The Extend Monofocal Plus IOL is designed to meet the diverse needs of surgeons and patients by offering both a toric version for astigmatism correction and a preloaded configuration for optimized efficiency in the operating room. The Extend restores patients' ability to enjoy everyday activities by enhancing intermediate vision, bringing clarity to the small joys of daily life, and allowing them to see clearly and feel confident in their vision, even in dim light. Extend your focus and expand your vision. Hanita Lenses.
Vision. What is our vision? That your vision will always be clear, lucid, and sharp. Well, we start with expertise. Knowledge, experience, and countless experiments and developments for over 40 years. Reliable. Every success begins with the people behind it. An extraordinary team of uncompromising people who develop uncompromising products. Quality. Using the most advanced technologies of the highest standards. As a leading principle, all our products go through the most rigorous examinations to ensure product quality. Transparent. Our business is lenses. Just like our products, it is clear to us that we need to be clear and transparent to you. Innovation. Our desire is to constantly innovate and to bring to you cutting-edge solutions. Hanita Lenses has trademark patents in addition to numerous project and development process. And you can't grow and succeed without partnership. Our employees, distributors, key opinion leaders, surgeons and patients are all our partners. Partners in creation and success. Only together are we able to create such significant impact. We do what we do because we believe that everyone deserves to see the world's beauty. And for that, we'll always continue and push our limits. Hanita Lenses, insightful innovation.